So now we're learning about this health care plan from 3 Republican senators unveiling a new alternative to Obamacare. Their plan would get rid of the mandates and the taxes while keeping some of the more popular reforms from on the record last night.
I think what we've tried to do is we've looked at it and said, how can we make health care coverage more affordable for every American?
The whole idea of this plan is to give affordable access care where you run your health care and your state makes decisions, and it's not mandated what you'll buy, when you'll buy it. There's no employer mandate. There's no individual mandate.
All right, there's a lot more to this plan. I want to talk about it with James Capretta, Senior Fellow of the Ethics and Public Policy Center. How are you, sir, and welcome back here to America's Newsroom. 4 big points. One I mentioned, the pre-existing conditions that will be covered under this plan. Let's tick through them. Get rid of the, well, what they want to do is allow employers to band together like big companies do and buy their health care together. Why is that so significant, James?
Well, a lot of small businesses are out there negotiating on their own, and if you have 100 employees, you can't get quite the deal you can get if you have 10,000 employees. So if you band a lot of small businesses together, allow them to work with an insurance company and a broker, they can get better deals for their insurance premiums and also negotiate lower prices from the providers, the hospitals and the doctors that are serving their workers.
Was that
so
done?
It's a way to leverage their market power.
Was that done before Obamacare, James, or not?
It's allowed to some degree now. Under this proposal, it would be much more facilitated, and it would be encouraged, frankly, under this proposal.
I see. So it brings down the cost, essentially.
Absolutely.
Now, one of the big rubs over this rollout has been the mandates that requires insurance companies to have certain coverage, certain policies for, well, just everybody who has that. This would get rid of these mandates, right?
Yeah, I mean, this proposal would beat Obamacare on basically every metric. It would cover people, it would do pre-existing conditions, it would slow the growth of costs without the government mandates, taxes, and huge spending of Obamacare. So it's a plan to address the problems that Americans want fixed without the big government baggage, frankly, of Obamacare. There isn't this shift of huge amounts of power to the Department of Health and Human Services. They couldn't dictate what's in everybody's insurance plan. There would be no HHS mandate, for instance, and all the other controversial aspects of Obamacare. This would be a much more decentralized approach to expanding coverage, slowing costs, and frankly, allowing Americans to decide for themselves what's best for their insurance plan.
The other one of the important tenets of this plan is the tax credit. Now,
Yes.
does that go to individuals? Does that go to companies? Does it go to everybody? And why is that important, James?
It's a credit that goes to individuals, not to companies. The individual household would control it, and they can use it to buy insurance. It's important because there are lots of Americans below about 300% of the poverty line and above about 100% of the poverty line who are working, actually have jobs, doing the right thing, trying to make a living for their families, but don't have good access to health care today because either their employer doesn't offer it or they can't afford it. And so this credit would allow these workers to buy insurance on their own, out in the marketplace, buying the same kind of commercial insurance everybody else gets, and give them the financial wherewithal to make sure they can get at least some kind of insurance. It would provide at least catastrophic protections for major medical expenses, and it would allow them to tailor the package to their needs, covering the preventive benefits they want or the doctors and hospitals that they want to see.
So it seems like it would give you a lot more freedom, especially on the individual level. One more thing here.
Sure.
Medicaid reform. Not getting rid of it, but reforming it. I mean, this is sticking in the crawl of every governor in America. How would they change it?
They would give the states much more flexibility and allow them to put these people who are currently in a isolated Medicaid program, put them into mainstream insurance so that they get access to the same doctors and hospitals as everybody else. And also, frankly, as they work, they wouldn't lose their coverage. If they get a better paying job, they'd stay with the same coverage and their subsidy would travel with them. So this Medicaid approach is really to give the states the authority to move in a market-based direction for their Medicaid program, allow a lot more flexibility, get rid of the Washington rules and regulations, and let the states run it.
How much or how do you think he will address Obamacare tonight? How's he phrase it?
I think that he'll obviously try to make it a very good news story, and he'll highlight the fact that it is covering some people that didn't have insurance before. That's what they're going to try to highlight. I would note that surveys have already indicated that of the people that have signed up so far, the vast majority already had insurance prior to Obamacare. What's happening is they're getting switched out of their current coverage and into Obamacare. So the net reduction in the uninsured is likely to be quite small.
Well, James, thanks. It's thick stuff, but it's important stuff, too. Thanks for coming back. James Capretta from Washington.
Thank you.